Dr. Vijaybhasker, Chairman Ethics Committee Clinical Research, Masters in Orthopedics. The fractures are common factor in our human body in this world. The fractures can be treated conservatively or surgically. The fractures to be dealt carefully and should be treated in a proper protocol, hence that the fracture union will be better and then the recovery is best. So what I mean to say is, when the bone is fractured, on an average in children it takes 3 to 4 weeks to heal, and in adults it takes 4 to 6 weeks minimum. So certain times when there is a delay in union leads to even 6 months to unite the bone. So obviously the 3 weeks to 6 months is the duration where the bone is well formed to unite itself. If not, then we should think of the possibilities of non-union. If there is a possibility of non-union, then treat accordingly. So when there is a fracture, the fracture itself, where the site of the fracture will have a lot of blood clot. The blood clot between the two bone ends, fractured bone ends, will form a calcium deposits, calcification, to unite the fracture. So the duration which takes to heal that bone is on an average 3 weeks to 6 months. So after the 6 months, we can determine that if there is no formation of the callus between the bone ends and there is a mobility in the fracture, that means the bone healing is delayed or non-union. So after that, we need to do a procedures where the bone compression can be made by removing the soft tissue or fibrous tissue in between the bones. So why bone is not uniting means there is a possibility that the anatomical reduction is not good. There is a possibility that there is lot of muscle tissue, fibrous tissue is between the bone fractures, bone ends, where the callus formation is reduced or not at all. So obviously when there is a fracture, we see if not healing, then we might require to accentuate the healing process by putting the 100% reduction in the fracture, then putting the bone marrow tissue into the fracture, and if not, then removal of the soft tissue interposition between the fragments, and then aligning the fracture with the bone cement or bone graft. So these are the various aspects we should treat the fractured ones to heal or recover with a good union after a certain time, so that the person can work better than before. Thank you.